Good day, I am Lara Nation, a second-year student nurse from University of San Agustin. Today, I am going to perform the Leopold's maneuver. So, the Leopold's maneuver is the standard palpation of the abdomen for assessing the fetal position, presentation, and degree descent. First, introduce yourself to the patient. Second, identify the patient using two identifiers like name and birthday. And then, perform hand washing to prevent the spread of microorganisms. Obtain maternal consent to the patient so that she will have the rights to participate in her own health care, which helps the patient to gain trust by ensuring good understanding. Now, explain the procedure to the patient for her cooperation and give the client opportunity to ask or raise her concerns. This procedure cannot be performed if the patient or client has a full bladder. It is important to instruct the patient to empty her bladder first because it promotes comfort and productive palpation because fetal contour will not be obscured by a distended bladder. Good day, ma'am. So I am Lauren Nashon, your student nurse for today. So may I know your name and birthday? So I am Sarah Castillo and my birthday is October 10, 1998. Today, I will going to perform Leopold's maneuver, which means I will place my hands in your stomach to figure out the position of your baby. Is that okay with you, Ma'am Sarah? Yes. So do you have any concern or clarification, ma'am? No. So don't worry, Ma'am Sarah, because I will assure you this procedure won't hurt you and your baby. But before doing the procedure, you need to empty your bladder, Ma'am Sarah. So next, I will going to place Ma'am Sarah in a dorsal recumbent position and supine knee flex. This is to relax the abdominal muscles, and I'm going to place a small pillow under the head for comfort. Then, I will drape Ma'am Sarah properly using a blanket to maintain patient's privacy. I will only expose the abdomen part. Warm hand first before placing them over the patient's abdomen to aid comfort because cold hands may stimulate uterine contractions, and in palpating, use the palm, not the fingers. First, Leopold's maneuver or fundal grip. It is the palpation of the frontal area to determine which fetal part is in the uterus fungus. It is also to determine the presenting part of presentation, the part of the fetus lying over the inlet. First, Leopold's maneuver. I am going to stand at the foot of the patient while facing her. So, I am going to place my both hands on the abdomen. Then, palpate the superior surface of the fundus or feel the fetal part lying in the fundus. There are 3 points to be observed in the first Leopold's maneuver. First is the consistency. The head is harder or firmer than the breech. Second is the shape. If the head will be round and hard, and the transverse groove of the neck may be felt. The breech has no groove and usually feels more angular. Lastly, the mobility. The head will move independently of the trunk, but the breech moves only in conjunction with the body. Second, Leopold's maneuver or umbilical grip. It is to locate or identify the fetal back in relation to the right and left side of the client or patient and to determine the fetal position. Now, I will still face Ma'am Sarah and place my left palm stationary on the left side of the uterus, which is located in a woman's lower abdomen, and the right palm or hand palpates the right side of the uterus on a circular motion from top to lower portion of the uterus, applying gentle but deep pressure to palpate petal outline and small petal parts, just like this. And after that, I will do it on the other side. The second Leopold's maneuver is small petal part slight knee and elbow feel nodular numerous angular nodulations. And the petal body feels smooth, hard like a resistance surface. Third Leopold's maneuver or Fowlick's grip. It is to determine if the presenting part has entered the pelvis and to find the head at the pelvis. Also, to determine the mobility of the presenting part. I will gently grasp the lower portion of the abdomen with thumb and two fingers of one hand by pressing them together slightly and make gentle movements side to side. For the findings of third Leopold's maneuver, if the presenting part moves round below the ball and easily displaces, it is not yet engaged. But if the presenting part is not movable, felt as relatively fixed, the oblique part is engaged. If it is firm, it must be the head, but if it is soft, it could be the breech. For the final Leopold's maneuver or the pelvic grip, which side is the cephalic prominence? Cephalic prominence is a part of the fetal head that prevents the deep descent with one hand. It is to determine the degree of the fetal head flexion or extension. To determine the attitude or habitus, the degree or flexion of the body, head, and extremities are the relationship of fetal parts to each other. It is also to determine fetal descent, and for this last maneuver, this should only be done if the fetus is in cephalic presentation. So for the final Leopold's maneuver, I am facing Ma'am Sarah's feet. So now I will move my fingers of both hands gently down the sides of the uterus towards the pubis. For the findings in fourth Leopold's maneuver, if it is descended deeply on a small portion, the fetal head will be palpated. If cephalic prominence or the baby is on the same side of the small fetal parts, the head is flexed. And if the cephalic prominence is on the same side of the fetal back, the head is extended. Okay, Ma'am Sarah, we are now done. So now, I will pull down your dress and you can do whatever comfortable position you want. Thank you so much for your cooperation because the procedure became quick and easy. Don't worry, Ma'am Sarah, because all of the data that I have gathered will be known only both of us for your privacy and confidentiality. So after doing all the procedure, it is important to document all the findings or data gathered.